does a normal person do when they're trapped in the heavy rain? Of course, get a raincoat or an umbrella. But have you ever imagined how does it feel when they're trapped in the heavy rain but no one gives them an umbrella or a raincoat? Of course, they will be cold and wet. Honorable judges and respected audience, this analogy is very appropriate to describe the mental health survivor in rural places in the world. We all know mental health now become a global issue, but unfortunately, we are still lacking of awareness. People tend to think about physical illness because mental illness is often invisible. There are also no proper understanding which lead to stigma and discrimination. In the big cities, some organization, movement and also campaign have been carried out to increase the handling of this mental health issue. However, what about people living in rural places? What about people living with limited access to information and also to the facilities? Studies in 2017 estimate that more than 700 million people live with mental health disorder, and half of it is living in rural places. While the prevalence of mental illness is similar between rural and also urban residents, but the service available is very different. Inadequate service for healthcare needs are not present in rural places that make it harder to handle this issue. At the very least, there are three big factors that become a particular challenge in handling a mental illness. The first one, accessibility. The second one, availability. And the third one, acceptability. Not only that we have to face all the barriers, our situations in rural area is exacerbated by the pandemic COVID-19. This outbreak may indeed happen globally and indiscriminate, but still, the gap between big city and rural area makes life in rural area in the middle of the pandemic is more painful. So, what is make it a big difference? The first one, the rural area are closely related to inequality and poverty. If before COVID they can still pay for the necessity for their life, after pandemic their work stopped and there is no savings, there is no income to them. So when they have no income to them, the cost of paying food, the cost of paying house rent and also school fees and uncertainty of tomorrow, of course, will provide a stress and pressure that may end in suicide. The second is the lack of correct information about COVID and also the lack of literacy in the community, which make hoax news spread very quickly. Hoax news will add to the fears and anxiety to the people in rural areas. And the third one, the new regulations that require a community to do a social and physical distancing. Since people are used to live with community and being entertained by the interactions they had, it will affect their mentality in the community. They will feel bored and also lonely that certainly contribute to increase the stress and also to depressions in rural community. We may think, well, that is what we feel also in the big cities. Yes, you may be right, but you have a many privilege to cope all the stress you have. You have facilities, fast internet, and also a lot of information that will keep you entertained and also productive. Your productivity, of course, will divert at least a little bit of your stress. So, what is the solutions to address this issue? The first one is, of course, increasing awareness. It may seem cliche, but it will work. The government in rural places and in a big city should be working together to conduct a project or a spreading campaign to the people. It can be done by the school or by the workplace. It's really important because a proper understanding about mental health will lead to the more open-minded people and eradicating the stigma. When there are no stigma, that will be less scary and less embarrassing for people to find a treatment. The second one is opening an access and provide an affordable healthcare and trained expert for people that will ease them to get it as soon as they need it. The training for professional is needed because the handling conducted should be cultural friendly so they can accept it. Solving mental illness, especially in the rural area and during this pandemic, is very difficult indeed. Limitations to move are very difficult also. But Our concern must remain to help ease their mental burdens because true wealth starts with a healthy mind.